Today, we're going to break down a really important report from the World Health Organization. It's all about connecting two of the biggest challenges we face, climate change and our health. You can think of it like a global detective story, trying to turn total data chaos into a clear plan that can actually save lives. So, we all know climate change is a health crisis, right? From dangerous heat waves to diseases spreading to new places. But just imagine trying to build a global defense against this, but every single country is working from a completely different blueprint. It's a mess. And that is the exact puzzle this WHO report is trying to solve. Here's how we're going to unpack it. First, we'll look at this global health puzzle we're facing. Then, we'll map out the path from a climate event to a health problem. We'll dig into the absolute mountain of data they analyzed, see how they found common threads in all that chaos, and finally, look at the quest for a universal health language to protect all of us. Okay, let's start with the heart of the problem, this global health puzzle. Right now, it's like every country is speaking a different language about climate and health. And if you can't understand each other, how can you possibly work together? It really is a tale of two realities. On one side, you have total data chaos. I mean, think about trying to coordinate a global fire department, where every crew has a different map and speaks a different language. It's impossible. It just cripples our ability to plan. The goal, the solution, is to create a common language, a universal set of measurements, so that a vital lesson learned in Bangladesh can directly inform a life-saving action in Brazil. So how in the world do you solve a puzzle this massive? Well, you don't have to start from scratch. The WHO team used a really logical framework to map the journey step by step from a climate event all the way to a human health outcome. And check this out, it's actually super logical when you see it laid out. It all starts with a climate hazard, like extreme heat. That, of course, leads to exposure, people working outside in the sun. But here's the thing, not everyone is affected the same way. Vulnerability factors like someone's age or their income play a huge role. And the final link in that chain, the health outcome. In this case, maybe it's heat stroke. It's a really clear path from cause to effect. Now, to measure each of those steps, you need something called an indicator. It's just a fancy word for a measurable variable that lets us track what's going on. Think of it like a signpost on a highway. It tells you if you're getting closer to safety or heading deeper into risk. So, to figure out what indicators countries were already using, the WHO team had to climb an absolute mountain of data. Get this, the team dug into 31 official reports from 22 different countries, looking at nearly a decade of data. And these weren't just random studies. These were the actual national battle plans, the documents that lay out how these countries are trying to protect their citizens from the health impacts of climate change. And what did they find in those reports? An absolute avalanche of data. From just those 31 documents, they pulled out almost 4,000 different ways that countries were trying to measure the problem. I mean, if you want a picture of what data chaos looks like, this number is it. But once they started sifting through all that noise, a really clear pattern started to emerge. Increased temperature and extreme heat were the number one concern by far, making up more than a fifth of all the hazards countries were tracking. This tells you exactly what's keeping public health officials up at night. And to make this really concrete, here's what one of these thousands of indicators actually looks like. It can be something as simple and as direct as this: the annual number of heat wave days. It's measurable, it's clear, and it's linked directly to a climate hazard. Okay, so you've got this messy pile of nearly 4,000 different indicators. What do you do? The next step was this massive job of finding the common threads, of trying to bring some order to all that chaos. This is where the real detective work came in. The team had to go through every single entry, one by one, filtering out the duplicates and merging similar ideas. Imagine 5 different countries all trying to describe the same problem with slightly different words. The goal here was to find that core idea and forge it into one single standard indicator. And this is that process in action. It's perfect. On the left, you've got these kind of vague ideas like mental health effects, but on the right, you get something concrete and measurable: the percentage of people experiencing stress. This is the critical transformation, turning a general worry into hard data that you can actually track and act on. And the result of all that meticulous work? They took that mountain of nearly 4,000 items and distilled it down to this: 1,684 unique, meaningful indicators. They cut the chaos by more than half, creating the first ever organized library of the world's collective thinking on climate and health. This whole process also revealed other really key insights. When they looked at what makes people vulnerable, socioeconomic factors, things like poverty and income, were the most common issues. That was followed by where people live and the strength of their local health systems. This tells us that being resilient isn't just about medicine, it's deeply tied to social and economic stability. So, all of this incredible work leads to the final crucial question. What's the point? What's the end game? Well, it's about building a universal language that can strengthen our global health resilience for the future. See, this report isn't just an academic summary. It's the foundation. It's the blueprint for the next critical step, which is to select a core set of the most important indicators that every single country can use. It's about moving from a giant menu of options to a recommended standard for everyone. And this isn't just a hopeful idea anymore. It has now become a global mandate. The World Health Assembly, which is the WHO's highest decision-making body, has officially called on all of its member states to integrate climate data to enable evidence-based decision-making. The call to action is now official policy. So why is this one change so incredibly powerful? Because a universal language means a strategy that works in one country can finally be adopted by another. It means we can finally track our progress as a planet. And, so critically, it means we can direct life-saving money and resources to the communities that need them the most, strengthening our shared resilience against a threat that, let's face it, affects every single one of us. This leaves us with a really critical question for our future. We know climate change does not respect borders. Its health impacts are going to be felt everywhere. So could something as simple as speaking the same data language, could that be the key that finally unlocks our ability to prepare together for the future that we all have to share?